Welcome to the Vision Quest video series, a step-by-step guide to holistic health. This series is comprised of 40 programs, each addressing a specialized area of holistic healing. In this program, we'll explore acupuncture. Roger Yunke, doctor of traditional Chinese medicine. And my background is that I always wanted to be a doctor since I was a little child, since my father passed away when I was quite young. And in college I went to pre-med and got a job in a hospital and everything, and I realized very quickly that that was not what I thought medicine was going to be or should be. And therefore I became a student of the world's original cultures, literature systems, I guess you would call it, the poetry, the dramas, etc. And interestingly enough, in primitive cultures, I found the kind of ideals of healing that I thought had maybe been lost here in the Western world. So I pursued traditional Chinese medicine, been to China 5 times, really amazing experience. China, very far away, philosophically as well as in miles. And I have had the wonderful privilege of being the director of a clinic for many years and being a consultant for numerous hospitals and HMOs, as there is a very fortunate turn occurring in the healthcare industry. Acupuncture is an ancient therapy developed over thousands of years. There are 265 to 2,000 acupuncture points identified by various schools of thought. In this program, we will review numerous acupuncture techniques that are now being embraced in the Western healing arts.
Acupuncture is an ancient Chinese therapy where patients are treated with needles pierced into their skin at particular points. These acupuncture points are located along invisible energy channels called meridians, which are believed to be linked to the internal organs of the body. The needles used in acupuncture are said to unblock or release an increase or decrease in the flow of energy called qi through the meridians.
I suppose if you had to define acupuncture, it's insertion of fine stainless steel needles into particular points on the body. And these points are related to what the Chinese would call channels of energy. And by puncturing these certain points, you balance up or cause an equilibrium of energy within the body.
In traditional Chinese medicine, the body is said to be a balance between 2 opposing yet complementary natural forces, known as yin, the female force, and yang, the male force. The yin force is passive and tranquil and represents darkness, coldness, moisture, and swelling, while the yang force is aggressive and stimulating and represents light, heat, and dryness. In Chinese therapy, an imbalance of yin or yang is believed to cause illness or disease. For instance, too much yang is believed to cause sudden pain, inflammation, spasms, headaches, or high blood pressure, or too much yin is believed to cause dull aches and pains, chilliness, fluid retention, discharges, or tiredness. Acupuncture therapy is aimed at identifying any imbalance and correcting it by inserting needles at appropriate acupuncture points. Traditionally, there are 365 points used in acupuncture. However, more have been discovered over the centuries, and most modern acupuncture charts may display up to 2,000 points.
The Chinese medicine, we consider there are about 14 mind meridians in the human body. In this meridian, in the meridian, there are different points, and different points have different functions relate to the different organs. So, for different conditions of disease, you select different points to balance the energy and to strengthen the body functions. For example, the stomach 36 in the area, so this point can strengthen the spleen and stomach function. It means it can strengthen the energy and blood functions.
Most important points used in acupuncture can be found on the 14 meridians, each named after an organ which it represents. These organs include the heart, the small intestine, the bladder, the kidney, the gallbladder, the liver, the lungs, the colon, the stomach, and the spleen. Another two organs found along the 14 main meridians include the pericardium, which controls circulation and sexual activity, and the triple heater, which controls the endocrine glands. Both these organs are not recognized by Western medicine, although they are very important in acupuncture treatment. There are also two extra meridians found on the body called the Ren or conception and the Dew or governor, which run vertically up the middle of the body. In traditional Chinese medicine, physical, emotional and environmental disorders in the body are believed to alter the flow of qi, making it either too fast, too slow, blocked or diverted to the wrong organ. An acupuncturist aims to rebalance and restore the flow of qi to its normal rate and thus allow the body to regain its harmony and allow healing to occur.
When a patient first presents themselves, they'll often present with a presenting symptom or sign, and from there we then do a differential diagnosis to, in traditional Chinese medical terms, to formulate a treatment principle, and then acupuncture points are then added according to the treatment principle. We diagnose in basic terms of yin and yang, but that is further delineated into patterns of energy according to the channels, the zhang fu or the internal organs of Chinese medicine, and also external causes of Chinese medicine as well.
In the West, acupuncture is used mostly for the treatment of painful ailments such as headaches, stomach and chest pains, joint pain, and back pain. However, in China, acupuncture has also been used effectively in people who suffer from allergies, anxiety, insomnia, stress, tiredness, or ulcers. Chinese acupuncturists also claim success in relieving withdrawal symptoms after giving up smoking or other addictive habits. Acupuncture has been practiced in China for more than 3,500 years. However, the exact date of its origin is still unknown. Legend states that this complex healing system developed when soldiers were believed to survive arrow wounds in battle and recovered from long-standing ailments by the insertion of needles into the body. The word acupuncture is a European term meaning to prick with a needle and was coined by a Dutch physician named Willem ten Rijn, who introduced this ancient Eastern practice to Europe following a 2-year stay in Nagasaki, Japan in 1683. The first medical textbook on acupuncture, dating as far back as 400 BC, was titled Nei Qing Su Wen, which means the Yellow Emperor's Classic of Internal Medicine. In the early 19th century, British doctors began using acupuncture to relieve pain and for the treatment of fever. In 1823, the first edition of The Lancet, a famous medical journal, carried a detailed report of the successful use of acupuncture for the treatment of rheumatism. Since then, numerous countries in the West have accepted acupuncture as a form of treatment.
Okay, Mary, we've been in place about 10 minutes. I'll just get those off for you now. Okay. Just relax, you won't feel a thing. One of the important and interesting things that's been occurring over the last 10 years is the idea that there does exist a number of different styles of acupuncture. Probably the major ones that we're aware of within the West are Japanese acupuncture, which is different than Chinese acupuncture, and also there's some other sub-schools as well, such as the Worsley approach over in England, and Mark Seam in America seems to be postulating that there are other avenues of using acupuncture.
An acupuncturist uses fine stainless steel needles which are inserted, usually in a quick, painless and bloodless procedure, and rotated between the finger and thumb to draw or disperse energy from a particular point. Individuals having acupuncture usually report a feeling of numbness or tingling over each point and along the corresponding meridians on the body. Most acupuncturists insert the needles so that they just penetrate the skin and may use as many as 15. However, in general, the more experienced the acupuncturist, the fewer needles he or she will use.
Acupuncture needles are ranged in both size and also diameter as well. We get anywhere from, the needles ranging anywhere from 1/2 inch to 6 inches in size, and in varying gauges or diameters of needle thickness. Of course, obviously, the thicker they are, the more sensation will be felt. And one of the characteristics, for example, of Japanese acupuncture is to use very fine needles.
When you put the needle in, you also have different technique. The technique just to help to relieve the pain. The pain usually caused is when you insert the needle in this very short period of time. After the needle passes the skin, the pain is not much painful. So the technique is skill enough. They will be related to the pain. The pain, if you have the good technique, and then you help to reduce the pain when you insert the needle. But after you insert the needle, and also use different technique to balance the body. You can use the reducing technique if the condition is excess, or if you feel the energy is excess, or you can use it with reinforcing technique when the disease condition is deficiency, or when you feel the energy is deficiency, or you can use the even technique.
The insertion of points a long way away from the origin of the pain or where the pain's existing is a common phenomena with treating acupuncture, and this relies a lot on the channel physiology. For example, the bladder channel is one of the longest channels, energy channels in the body, starting at the little toe, running up over the back and finishing in the inner canthus of the eye. By puncturing a point on the ankle, it can, because of its channel connection, can affect the back of the head. So one of the points near the ankle, kunlun, bladder 60, is often used for occipital or back of the head pain.
Traditional acupuncturists use the Chinese form of diagnosis and follow the ancient rules of Chinese medicine to select various acupuncture points. He or she will use the tongue diagnosis, skin and texture colouring, hair texture, posture and movement, breathing and voice texture to determine a patient's medical status. A traditional acupuncturist will incorporate diet, lifestyle, exercise, quality of sleep, phobias, and reactions to stress, and will also use the 12 pulses of traditional acupuncture to ascertain an individual's health. This process is called palpating and refers to the way in which acupuncturists diagnose disturbances in the flow of qi in any of the organs in the body.
Pulse treatment is an essential part of Chinese medicine. As you saw me demonstrate before, when we palpate the pulse, we look for a number of different qualities, and they can indicate some underlying energy disturbance. We look at things such as speed, shape, quality of the pulse, depth of the pulse, and all these things give us an idea of what type of condition the energy is in the body for that particular person.
The pulse, in both hands, they will be show up different relation to different organs of the body. For example, the left hand will relate to the heart, the liver, and kidney, and left and right hand relate to the lung and spleen and kidney as well. So when you take the pulse, you take 3 levels, from the superficial, medium, and deep level. And these 3 levels, they will be show up the different quality of the pulse and the internal organ functions.
And so if something is weak or over-energized.
Yeah, the pulse we can say have about 28 counts of the pulse, but we mainly use is the A pulse, like fast, slowly, or full or weak, or floating or deeper. So this different pulse will show up different things, different conditions.
Qi is a term that's often heard in relationship to Chinese medicine. The character itself was broken up into 2 radicals. The first radical means rice that's cooking. The second radical means vapours flowing up towards the sky. So I suppose the connotation is it's some type of energy that's ethereal or invisible, but it has the possibility of giving the body life.
Ancient Chinese practitioners of acupuncture have established certain points over the centuries for specific ailments. These may include lung 7 for headaches, kidney 1 for hypertension, stomach 42 for toothaches, stomach 45 for insomnia, bladder 54 for lumbago, or governor vessel 23 for nosebleeding. The local points for each specific organ, such as the digestive system, are as follows: liver, bladder 18, gallbladder, bladder 19, stomach, bladder 21, colon, bladder 25, small intestine, bladder 27, and intestines, conception vessel 4 and 9, stomach 25, or bladder 24.
These channels of energy are actually related internally to the organs, and by puncturing one of these channels, you therefore affect the qi of the organ and also the qi of the channel as well. And in the West, we've given them numbers, but the Chinese have always associated names with them, and very poetic names. Points such as this one here, that's a very common one we call Hegu, which means joining of the valley. Now you can see why they got that name, because it's a valley actually joining. The other point I mentioned before is 3-leg mile down on the leg, stomach 36. That's again been thought to be given its name because it's three anatomical inches below the knee. Another point here is on the elbow is called crooked pond, and obviously it's because the energy pools there and that the elbow is often bent. So there are very poetic or metaphoric indications lying behind the names.
When you use acupuncture to treat the disease, you also have to take a long consultation to get all the information from the patient, first you first have to ask different questions, and then you take the pulse. Take the pulse and look at his tongue and the face. Sometimes you're going to palpate his abdominal to get different information. The pulse and the tongue, you can say, is the window of the internal organs. After that, we're going to use traditional Chinese medicine theory to dialysis. After dialysis, you may find out the patient is caused by deficiency of the qi, or deficiency of energy, or deficiency of the blood, or energy, or blood stagnation, or another kind of the facts cause this problem. And then we're going to choose the point. Because different points will have different functions. So we choose the point according to the diagnosis. So some point can help to move the blood, some point can help to move the qi, and some point can strengthen can tonify the qi and tonify the blood. Or some point can remove the damp and heat from the body. So that we have all the things we need to do before we use the needle to treat the people. For example, the case we treat the sciatic nerve, with diagnosis is this sciatic nerve caused by the stagnation of the energy and blood, and also have some attack by the cold. So I choose the brother 62 to move the energy and blood, and choose the brother 40 to manage to move the blood as well, and choose the local area, the gallbladder 31 to help to move the qi, move the energy and blood, and clean the cold as well. And the arch point where is the painful, that mainly is caused by the cold or stagnation of the blood. So we use the moxa as well to help to clean the cold, to remove the blood and relaxing the muscle. After insert the needle, first we do the manipulation to find the qi, to find the energy, to find the sensations, and then you lift the needle in the body. The needle will be retained in the body about 20 to 30 minutes, and each 5 minutes we're going to do some manipulation to strengthen the energy. Let the energy floating through the meridian to help to remove the qi and blood. After the needle retained in the body about 20 minutes to half hour, we're going to withdraw the needles. When we withdraw the needle, we also use different techniques. If you dialysis, the disease causing by, if the disease is excess, when you withdraw the needle, you don't need to cover the point. If you diagnose disease deficiencies, when you withdraw the needle, you have to close the point. Don't let the energy run away.
And how do you do that? How do you keep the energy in?
Just use the left hand to close, to press the point.
Could I just have a quick look at your tongue, thank you? Okay. Yeah, your tip of your tongue there looks a little bit red, and you've got a little bit of a quiver to it as well, which means could associate with When Mary first presented, she presented with basically signs such as palpitation, tiredness and weakness. Going through a series of the diagnostic procedures, looking, seeing, feeling, smelling, touching, we came to the conclusion that she fitted into a syndrome that we call heart-chi deficiency, which means the energy of the heart is low. So the treatment principle is to tonify the chi of the heart. Now, in Mary's case, we used two particular points that had that effect. The first was a very well-known and famous acupuncture point on the leg called stomach 36, or Tsutan Li, and that has the effect of tonifying the energy within the digestive system, and that flows on to affecting the whole of the body. The other point we used was called Shen Nen, or spirit gate, and that has the effect of calming what the Chinese call the Shen, or the consciousness, and has a very calming, relaxing effect on the heart. I also use an extra point between the eyebrows, which just generally, symptomatically, is effective for insomnia and calms the spirit, the Chinese would say.
And how about the pulse diagnosis? What can the pulse tell you, and what did it tell you in this case?
Right, the pulse in this case indicated, what I was looking for there was the frequency of the pulse, how fast it was. In Mary's case it was slightly slower than normal. It was also a weak pulse. The quality of it was not as strong as you would expect. And there was also a little bit of intermittency associated with the pulse, which means the energy wasn't pushing the blood through in a smooth fashion. So that to me indicated that the energy of the heart was low and needed to be tonified. Cupping again was probably one of the modalities often associated with mechanical stimulation on the surface of the body. The main premise of acupuncture is that you can stimulate or affect the insides of the body through external stimulation. Now, as you've seen before, that can either be through the insertion of a needle, through modern techniques such as laser, or through techniques such as cupping, which again stimulate the acupuncture point or the energy on the surface or the channel of the body. Cupping is used basically to draw qi and blood to the area. It's also used to disperse qi and blood to the area. There's a technique that we often use called moving cupping, where you move the cup up and down the body and trying to disperse the qi. The main uses of cupping are in things such as respiratory conditions and also muscle aches and pains as well.
But are there points that you put it in? Or?
Yes, you can put it on certain points, and most of those points are associated with the bladder channel, which runs down the back. For example, if you're treating a lung condition, often you'll put it over a couple of points called bladder 13, Fei Shu, or bladder 12, Feng Shu, which is Win Shu, the Win Shu point, and the Lung Shu point, and they generally have the effect of affecting the energy of the lung. Moxibustion actually started separate from acupuncture, they believe. We think it came from more the northern or colder parts of China, and it is actually still used with Tibetan medicine as its own type of modality of treatment. And basically, moxibustion involves the application of heat to the acupuncture points on the body. Traditionally, it was always done with direct moxibustion, which means a little bit of the moxa herb was actually put on the point and burned on the point, but this would often leave a blister. And obviously these days there are other methods that we can use to apply indirect heat to the body. That may be such things as the use of a moxa stick, or it also may be the use of moxa on a slice of ginger. Electrodes are common, is a more of a recent phenomena, and basically it involves the insertion of a little electric current into the needle and acts basically to increase the effect, the subjective sensation of the needling with the patient. It's often used where pain is the main problem, but if you're treating energetic problems with the body, often it isn't used.
What are they? Can you change the frequency or the voltage? Or?
There are a number of different parameters that are associated with using electro. The first one is the frequency. The second is the intensity, and the third is the mode of transmission of the frequencies. Again, scientific research has shown that some of the lower frequencies, such as 4 hertz or 4 pulses per second, tend to turn on a different system within the body, and the higher frequency tends to turn on another different system within the body, releasing different neurotransmitters. So therefore it's important to be able to know what you're treating with it and what the best parameters are for treating with electroacupuncture.
And I guess it's pretty safe. I mean, you're not electrocuting anyone.
They're all run off batteries, so there's very little chance of electrocution. Yeah, there's no chance of electrocution. There are some contraindications. Again, you have to be careful on what patients you're using, and it's not a common usage with acupuncture. Probably a small percentage of people that present with acupuncture get electro.
And how about the laser?
Laser, again, is a recent phenomenon. It's probably been in use 20, 30 years. Again, it works on stimulating the acupuncture point through light energy. And again, scientific research has shown that it can be effective for a range of different ailments. The most effective things are such as pain, muscle tears or ligament tears, and also ulcers as well, which have been shown to be effective for treating skin ulcers. There are a number of precautions that are associated with getting acupuncture. They may range from minor things such as fainting or bruising, bleeding around the point, to other major complications such as a pneumothorax, which is a puncture of the lung by a needle, or puncture of the internal organs. Obviously, it's important when you do get acupuncture, you go to someone that is trained exceptionally well in anatomy and understands the body in detail and can use acupuncture in a very safe manner. Up till about 15 years ago, needles were reused and sterilised, but you find in the last 10, 15 years, with the advent of AIDS and also other infectious diseases, that pre-sterilised needles are pretty well used by everyone doing acupuncture. They're very cheap. They range in price from 5 to 10 cents each, and for the amount of, or for the relief of mind that's associated with using pre-sterilised needles, both from a practitioner's point of view and a patient's point of view, it's well worth that extra couple of dollars. It's quite interesting you mentioned the medical view of acupuncture. That's changed over the last 20 years. I remember reading the 1974 NHMRC report, which said that acupuncture was a load of codswallop. And in the late 70s, they then started discovering endorphins within the body. And then in 1989, the new NHMRC report came out that validated that acupuncture was effective for pain. They discovered mechanisms that it could work for. So therefore, most clinical research, Western scientific research, validates the effect of acupuncture, mainly for pain, but I'm sure over the next 10, 20 years, as more research is done, that there will be other mechanisms that are elucidated to show that acupuncture is very successful for a whole range of different conditions. I think acupuncture has changed in China over the last 40, 50 years as well. Obviously, as a art, it has to develop, and I think by coming to the West, it again has adapted slightly to the Western culture and the Western needs and Western disease states and conditions, rather than stuck to the traditional concepts in China. That doesn't mean to say we don't use concepts such as qi and yin and yang and things like that, but obviously the Western people or the Western person does have a different lifestyle, a different cultural background, different social infrastructure behind them, and therefore they may suffer from different conditions and were present in China 200, 2,000 years ago. So yes, it's an ongoing development within the art and practice of acupuncture itself. And that's actually evident by the Japanese. The Japanese again have adopted it towards what they wanted over the last 500 years, and it has distinctive features of that are quite different than the Chinese approach.
Currently, there are about 100 different countries that use acupuncture to treat the disease. Such like Japan, Korea, French, England, and American, and Australia.
And where do you see that going? Do you see it more countries and
Yes,
becoming more accepted?
I think acupuncture will be more and more popular in the future, and more countries will accept these therapies.
I suppose I see the future of acupuncture going in the sense that with the global unification of our world, with increasing telecommunications, that it will be integrated into a more uniform form of therapy around the world, that it will not just be owned by China, that it will be a world medicine, and as such that it will be integrated in with aspects of Western medicine and also other traditional medicines as well. I think it's got a lot of growth as yet, and a lot of research needs to go on to elucidate what is the best things that acupuncture treats and how effective it is for certain conditions, so that we can actually work out what are the parameters of its effect on disease and disharmony within the body.
As a form of healing, the insertion and manipulation of acupuncture needles is fairly simple, yet uses a very ancient and sophisticated form of diagnosis, analysis, and practice. This ancient therapy is becoming increasingly popular throughout the Western world as a complementary form of medicine, helping to alleviate many ailments safely and effectively.